Hey there, everyone. This is Tuan Pham with DentalMaverick.com. And as I promised, I have some awesome information for you so that you can help educate your patients on why certain treatment is needed. And in return, it's a win-win situation because your office obtains and gets the production that you're interested in. If you haven't checked out my website, it is www.dentalmaverick.com and take a look at it. Watch the first video for the 48-week course on the main page if you want to, and I encourage you to click on the testimonials. View some video and live testimonials of some of my clients and the successes that they've had. For example, I've had some dentists, an orthodontist particularly, go from $45,000 a month to over $120,000 a month recently. We have a general dentist in Tennessee going from about $30,000 a month and barely covering overhead to over $77,000. And one of our latest updates, he's almost at six figures, and instead of contracting and his office, he's actually expanding and getting more hygienists and building more rooms. We have other doctors in Katy, Texas, doing $1,500 more a day. So it's awesome. Take a look at the testimonials. Take a look at the first video on the main page. And hey, take a look for yourself to see if there's something you're interested in. If you are, then I can help you become a better leader, communicator, a manager, and in return, it's a win-win situation, like I said, because your patients understand why they need certain procedures more. You win in the long run because everything's smoother at your office, you're more productive, and your life enjoyment and career enjoyment goes up. So, like I promised, here's some very valuable information that you can start using today or tomorrow, whenever you see the next patient. So one of the biggest things that a lot of dentists have problems with or issues with is they don't like explaining perio or diagnosing perio. And you hear many doctors that just say, oh, we just do prophies, or maybe not yourself, but you hear of offices where they say, you know what, this patient's been going to this office, they just do prophies. And maybe the reason is, deep down, a lot of these dentists, or yourself perhaps, have had a lot of problem getting treatment plan acceptances, for perio, because it's one of those things that simply doesn't hurt. So patients, if we don't have that pain sign, we don't have that pain symptom, it's very easy for the patient to say, you know what, I don't know what's going on. I think this guy's trying to upsell me. He's trying to explain something to me that's not true. So here's a snippet, here's an example of what I do that can help you greatly gain treatment plan acceptances for this procedure. So like I was saying, pain is a very motivating factor, okay? And if you've listened to our podcast, one of the things we talk about is that stories and analogies are very important because they can help the patient paint this image through their head, walk through this explanation of whatever you're explaining, and in the end, they come up with a decision and the conclusion themselves, and hopefully the conclusion is, oh, this makes sense, and I need treatment for this condition because I don't want it to get worse. Like I said, when there's a pain sign, it's very accurate. It's if you have an emergency patient coming in, you don't have to really convince them. They know that they have an issue going on. But gum disease is a little different. So here's what I say, for example. Now, I don't know about you guys, but I'm from Texas, so we have very hard water, meaning that if you look at our shower heads or faucets, we get that crusty calcium buildup. Maybe you call it soap scum. We call it hard water, whatever it is. So one of the things that I'll tell a patient is, I start off some statistics. I like to tell patients that there's a high percentage of Americans that have gum disease, okay? And I tell them, hey, Google that percentage. And personally, I've done it myself, and I've seen some percentages that say in the 60-something percentile. I've seen statistics up in the 80th percentile. That somewhere in their lifetime, a patient, a typical American, will have periodontitis occurring. So one of the things that I might go into is a lot of times patients ask me, well, why is that number so high? And then I'll say something like, well, there's a couple of reasons, but here are the main reasons. First of all, we're trained for discomfort, meaning that something hurts in our body. We're very motivated to seek out that solution. My foot hurts, my finger hurts, I sprain my ankle, something hurts enough, I'm going to go to the doctor. But when it comes to teeth and gum disease, which I'll clarify in just a second, many of these conditions don't typically give us early pain or warning signs, and so that's why it creeps up on a lot of people. And that's true. There are many people that went to doctors and dentists that didn't diagnose perio, and then before you know it, you see them, they got these long roots and everything. Well, they probably didn't diagnose it because it doesn't hurt, and they're waiting for the patient to maybe bring it up, perhaps, okay? But obviously, I think that's a bad idea because you let an irreversible condition go worse. Another thing I was saying was the average American also doesn't floss their teeth. And a lot of times you'll see patients, they grin, so you have an idea if they floss their teeth or not. So one of the things I like to tell patients to do is floss their teeth, but before they throw away that piece of floss, to smell it. Because if you smell that floss, you'll see that there's proof that builds up on your teeth all the time. And I give them this little story about myself, which is absolutely true, that personally myself, I got cavities all up till about age 19 because I didn't understand why flossing was done. I would floss my teeth if, say, I got a piece of meat. I felt uncomfortable. You feel it with your tongue and you're trying to get it out. We all know that feeling. That's when the average American, average person will floss their teeth. But the rest of the time, like myself, up to age 19, I didn't know why until I had this dentist tell me, smell your floss, but before you throw it away, just smell it, and it gives you daily constant proof that there's buildup on your teeth. So I tell patients something like that, but then I paint more of the story. Well, I tell them, hey, you know what? Well, when it comes to gum disease, that plaque that you smell, that stinkiness that you smell is called plaque. And what is plaque? Plaque is food debris. It's a bacteria. And then I relate to them this other story. I'm like, you just got your teeth cleaned today, or you're going to get your teeth cleaned if I walk before the exam. I tell them, think about any teeth cleaning they've had in the past. Well, think about it. What do they do? What do we do? What do hygienists do? We scrape on your teeth. So I tell them, well, why would we scrape on your teeth if plaque is soft? When we just brush away your teeth? So I tell them, smell that floss for that proof. But the reason why we have to clean your teeth and scrape your teeth when you get your teeth cleaned is because that plaque hardens. It's like hard water around your sink or shower head. In Texas, we have minerals in our water, so we get this hard water. Well, we got minerals in our saliva. That's why we get calculus and tartar buildup. So now in their minds, they're building this image like, oh, that makes sense. Now I know why I got to floss my teeth. Now I know why when I go to the dentist, they scrape my teeth. And then I talk a little more. I explain to them that this calcium buildup. I simplify things. We know the details much more, but we don't have to explain everything super technical to patients. They just want a picture or visual. So I tell them, hey, that calculus or that buildup that you feel when they scrape your teeth? Well, imagine that buildup getting bigger and deeper, going underneath your gum line until it settles towards this, which is your bone level. And that's a very good image for someone to assume. And if you got subgingival calculus, what happens? There's bone resorption over. So I explain to them as that buildup gets closer to the bone level, there's bone loss. And that's why periodontitis occurs. And I explain to them this bone loss doesn't hurt. If you know anyone that has loose or wiggly teeth, grandparents, aunts, uncles, well then, ask them if their teeth hurt. If the teeth hurt when they're loose, and a lot of times they don't. And sometimes I don't tell them that story, but the main important part is the process of why bone loss occurs, and they're building this image in their head, and they're assuming. And then you explain gum treatment. I tell them the generic term is a deep cleaning. Why is it called a deep cleaning? I hear the synonyms, blah, 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 but why is it called a deep cleaning? Because we're going deeper underneath your gum line to remove that buildup. If we remove that buildup, then your body has no reason for further bone loss. And one of the things as you know, it's very enjoyable, at least I think so, if we can convince someone to have a good flossing habit. So one of the things I also tell patients, whatever I recommend for you is very good and very beneficial to you. But remember, the rest of the year, 360-something days, it's all you. So if you don't have good habits, meaning good brushing or good flossing habits, then eventually you'll have a quicker relapse. And so hopefully that stimulates the patient also to have good flossing habits. So that's just one of the tidbits that I talk about. And as you can see, the main important point is whatever you're explaining, and in in my Dental Maverick series, which is a 48-week video, actually I made it 49 weeks now, with an extra video that is almost 90 minutes, I believe, that gives you over 10 years of practice, all my stories and analogies that help explain treatment to patients. But that's just one aspect of the training series. The 48 video week series is designed to teach you better leadership, communication, management skills. You hear a lot of dentists say that I wish I just went to work, did my dentistry, and didn't have to deal with staff training or all the stuff in the office or all the hassles, all these little things. But you know what? If you're a dental maverick, you'll realize that all these little things that you don't like, yeah, they're little things you don't like, but if you don't ever correct it, it's going to haunt you for the rest of your life. And how miserable is your career if you don't address it? So if you're a dental maverick, one thing you realize is each issue is the opportunity to find the solution and success. And that's why we have some of the students that are clients of mine, they become very successful. They change their lives and everything around. The guy that I mentioned to you that was doing about 30-something thousand, his name is Mark Reginald in Tennessee. You might know him. He was about to sell his house to move his family into an apartment because he couldn't pay his overhead on his office. And now he's successful. Last I talked to him, 4 months ago, he's doing 77,000. I talked to him last week as of July 31st. July 31st. He's almost to 6 figures a month. And now he's expanding his office. And actually, our series actually includes now a 25 video series to train your office. where I will teach your staff the principles of Dental Maverick, basically what you learn, more condensed. Why management is needed, because if your staff understands why management is needed, just like mine does, they see when and they see the value of when you have to talk to them because they know it's to their benefit, believe it or not. And lastly, my goal is to teach them to self-manage themselves, so your need to actually talk to them and manage them on a daily basis is greatly diminished. So anyways, take a look at my website. I hope you like it. But one of the things that I hope you really saw beneficial was from this explanation of why stories and analogies are very important. If you can paint this picture, you notice how you're probably imagining all the soap scum buildup or hard water buildup in your mouth and around your teeth, and how if we remove that with a deeper cleaning, it makes sense. So if you can get the patient to understand that and visualize it in their head, your treatment plan successes will go up dramatically, and so will your profits. And in return, it's a positive feedback. You know, if you're more productive, you feel better about yourself, you feel more confident, and you feel more happy, hopefully, because you have more control of your life. And we're dentists. What do we want? We want control of our lives. And so if you have problems with anything like leadership, management, or communication, then I can help you with it. So I hope you like this, and I hope you found it very beneficial. But this is just, 0.5%, 1% of, even less of all the things that I can teach you over 48 weeks. So hope this helps, and good luck. Check out my website. Bye.